Hello, my name is Mia. I am the Total Joints Coordinator for Mercy Medical Center. Navigating through your surgical experience can be very challenging and difficult. I'm actually here to help guide and support you and your family members through your surgical journey. Preparing for your surgery is very important, and preparing for your surgery, it can help ensure a smooth and safe transition to home. Our team here at Mercy Medical Center is committed to providing best care and exceptional experience for you and your family. Our goal is to educate you and involve you in every step of the way, and to guide you to a more successful surgical outcome. This will increase your chances of returning to a better quality of life as quickly as possible. One of the most important aspects of your surgery will be physical therapy and occupational therapy. Brian and Sarah will take you through exercises that you can do before surgery and, most importantly, after surgery.
Hi, my name is Sarah, occupational therapist here at Mercy Medical Center. Our goal is a safe transition from the hospital to your home. We will be demonstrating appropriate ways how to dress yourself, bathe yourself, use a toilet, and how to use the walker safely in the restroom. We will be also handing out t-shirts and shorts, which will be doing actual dressing here in the hospital, a toilet razor, a shower chair, or a tub transfer bench to remain your independence in your self-care upon return to home. OTs will also demonstrate long handle equipment such as the hip kits to assist you in maintaining your hip precautions in performing your ADLs or your self-care at home.
Hello, my name is Brian. I'm part of Mercy Medical Center's Rehab team. I work in physical therapy, and our goal is to get you back to where you were before. Therapy is really important to get you moving better, walking, get you stronger, get that mobility back in that joint. Now you have a replacement, so it's important not only to work on activities before your therapy or before your surgery and also after, so we can get you back to the activities that you loved before.
So today we will be donning your shorts and your shirt in order to practice performing before returning home. You will be receiving a shirt and shorts, which we will be wearing this morning. For the first few weeks after surgery, you will be performing your dressing and sitting down. And you will be inserting the surgical leg in first into the garment. And then the opposite leg goes in. So for dressing, you'd like to have your walker on standby, just for safety. Pull it as high as you can. And you're going to be pushing off from the bed and one hand on the walker and using your good leg to push off. And lift your shorts up to the waist. Great. So after hip replacements, there will be some limitations. So we have adaptive equipment from occupational therapy I'll be showing you today to improve your independence upon returning home. So one of the equipments we have is a long-handled reacher, which will help us in getting your lower body garments on, your shorts on. We'll be using this equipment to assist you and retain your independence upon returning home, okay? So we will be inserting the surgical leg first into the garment. Okay, if you can kindly, there we go. And then put in the surgical leg first. And then the opposite. All right, and again, have the walker on standby. Push up with one hand on the walker. Use the good leg to push up and lift the garment up to your waist. Okay. Good job. Aside from the long handle reacher, we also have a sock aid to help you put on your socks after surgery. You're gonna simply put the sock in to our sock aid here and put that foot in and pull up. There you go, you got your sock on. So to help you wash your feet and your legs after surgery and no need to bend too low, we have a long-handled sponge that you can use to assist you washing your feet upon return to home while maintaining your hip precautions. So all these devices I have shown you is called the hip kit. They're especially used by patients who've had hip replacement and adhering to their precautions of limited bending forward, and to do your dressing, your bathing, and putting on your socks safely at home. You'll be going home with ice packs. We have two kinds, one for the knees and one for the hips. These ice packs come with gels. We're gonna be giving you 4 pieces, which is 2 sets each. And the best time to put these on is after your exercises at home. This is done to reduce the pain and the swelling. And for the knee, it's simple. Just put on top and secure it with the straps. So please avoid walking when this is on your knee. Okay, 20 minutes of ice after exercise and you'll be good. So for the hips, we have straps so you can secure the ice pack on the area. So the first one goes around your waist and the other goes around the leg. Again, please avoid walking or ambulating with the ice packs on you. Occupational therapists would be recommending elevated toilet seats for patients who've had hip replacements in order for them to protect their hip after surgery. So today we'll be installing it. It goes right in front of the toilet. And we have illustrations here to lock it and to unlock it. So we'll be securing the elevated toilet seat by turning the knob towards clockwise to secure. So we're going to be demonstrating how to sit down on the toilet with an elevated toilet seat. Make sure that you back up and feel the commode behind your legs and reach back for the seat and slowly lower yourself down.
Okay, so the first exercise I'm going to instruct you in is ankle pumps. So this simply involves moving your ankles, so pumping your feet down and back towards you. You're going to do this about 10 repetitions, nice and slow and controlled. This is an exercise you can do throughout the day for circulation. Okay, so the next exercise I'm going to demonstrate is the quad sets. So this one consists of putting a towel under your ankle, a rolled towel under your ankle. So you're going to relax your leg there. And in this position, you're going to tighten your thigh muscles and pull your toes towards you. And you want to hold those quad muscles nice and tight for 5 seconds. And then relax it. So normally we'll have you do about 10 repetitions. So you're going to hold 5 to 10 seconds and just staying comfortable. So tighten the thigh, pull the toes towards you. And this is working on extending your knee. Okay, the next exercise is glute sets. So this consists of tightening your hips, squeeze your buttocks. You're going to hold that for 5 to 10 seconds. And everything else is relaxing. So all you're doing is tightening your hips. Hold for 5 to 10 seconds. And then relax. This is very important for hip strength, which we need to get up and out of the chair, up and off the toilet. And then relax. And how strong you tighten the muscle is just what's comfortable for you. Okay, so the next exercise is heel slides. So this one consists of sliding your heel towards your buttocks. So you want to work on bending your knee and then straightening it all the way out, going all the way flat on the bed. Now this is working on the range of motion, getting your knee to bend. So initially you may not be able to go very far, but the goal is to work on going a little further each time and staying as comfortable as possible. Nice and slow, back and forth. So the next exercise is a short arc quad. This one consists of putting a rolled towel or folded pillow underneath your knee. Relax your leg. And now you're going to extend your knee, pulling your toes towards you as straight as you can get it. And then let your foot all the way down to the mattress. Good. Each time you're working on straightening the knee, toes back. Just keep it resting right on that towel roll. And then relax your leg completely. Relax the foot. And then repeat that same thing. So toes back, knee extended, and then down nice and slow. Good job. Okay, so the next exercise is the straight leg raise. So this one consists of tightening your thigh muscles, pulling your toes towards you, just like the quads that you did earlier. And now you're gonna lift your foot off the bed 8 to 10 inches. Hold it nice and straight, and then let it all the way down to the mattress, and then relax your leg. So each time you're gonna tighten the thighs, toes towards you, lift your leg up 8 to 10 inches. Good, keep that knee as straight as you can, and then relax it down. Good job. Okay, so the next exercise is hip abduction, adduction. So this consists of keeping your leg straight. You're gonna slide your straight leg towards the edge of the bed, and then back to the middle. Just trying to keep your leg straight, using your hip out to the side, back to the middle, and just staying comfortable with that same movement. Good job. Okay, so the next exercise is the long arc quad. This one involves lifting your foot, extending your knee as straight as you're able to go, and then let your foot down to the floor. Good. And repeating that same thing, straightening your knee, down to the floor. Now initially you won't be able to go very high, but we'll work on helping you with this so you can achieve full extension. And normally we would have you do about 10 repetitions. Slow and controlled movement. The goal is to be able to fully extend your knee. All right, good job. Okay, the next exercise is marching. So you're literally just gonna march while you're sitting. So bring this knee up, and then down to the floor, and then the other side. Just alternating slowly, working your hip muscles, keeping your knee bent as you march back and forth. Again, staying comfortable. And if assistance is needed, we'll help you with this exercise. Good job. Okay, so to get out of the bed, what I'm gonna have you do is I'm gonna have you bend your strong leg, and you're gonna work on scooting your hips towards the edge of the bed, and then using your hands to get behind you to sit up, and I'll help guide you with your surgical leg. You're gonna turn your hips, use your arms to bring yourself forward all the way to the edge of the bed, and we'll help you guide your leg so your foot is on the floor. Okay, so now we're gonna teach you how to get up from the bed, and then we're gonna have you teach you how to use the walker, and also instruct you in the proper height of the walker. So first thing I'm going to do is put a gait belt around you. This allows me to help you with your balance if needed, for your safety and mine. So I don't have to worry about grabbing a limb. I can just use the belt to assist you. It's going to be kind of snug. All right, now to stand from the edge of the bed, you can either put both hands on the mattress and stand in that fashion, or you can put only one hand on the walker and push up with your strong side. Use your strong leg to stand. So go ahead and stand all the way up, push up straight, and then grab the walker, and then slide your surgical leg underneath you. Very good. And then sitting down would be just the opposite. You want to make sure that you reach back with one hand for the mattress. Go ahead and sit down nice and slow. Good job. So the walker height should roughly be about the height of your wrist. So if you relax your arm down, the height of your wrist should come to the top of the walker. So, and then when you're walking, so both hands on the walker, walking with the walker, you're always going to step, use the walker, push the walker forward first. Then you're going to step with your surgical leg into the walker, making sure that your toes stay behind the wheels of the walker. And then you're going to push on your arms and step with your strong leg. Good. And you repeat that same movement. Walker first, surgical leg into the walker, and then step with a strong leg. So now I'm going to teach you how to use stairs with your surgical leg. So you want to use the walker, get as close to the bottom stair as you can. And you'll hold onto the rails. I'll remove the walker. When you go upstairs, you're going to start with your strong leg first, and then the surgical leg. And repeat that same sequence. Strong leg, then surgical leg, all the way to the top. When you get to the top, make sure when you turn around that you turn slowly, don't twist. You want to get all the way up to the edge of the step. You come down, it's going to be the opposite. Now you're going to come down surgical leg first, and then strong leg, surgical leg, strong leg. Same sequence all the way to the bottom. Grab your walker. Good. And then the same sequence would be for a curb. If you go up a curb, you step up with your strong leg. When you come down the curb, you'll start with your weaker leg.